was Mike.
Probably 99% of these dents are from Mike Ennis. He just gets mad and he pounds it.
He doesn't have a problem utilizing it.
Yeah, he's a gavel happy son of a gun.
Well, he's really quiet, and
When you get him fired up.
He's got a little short fuse sometimes. So.
Yeah, don't tick him off.
we wouldn't know what that is.
Do you have anyone like that on your board?
You want a gavel? I'll bring a damn gavel.
Good morning, everyone, and thank you for joining us for the meeting of the San Joaquin Valley Insurance Authority. Welcome to Tulare County. It's much easier to get here and much nicer to be here than Fresno County. We will now take up item number 2 on our agenda, which is the Pledge of Allegiance. We will be led by our colleague, the Godfather, this morning.
Ready, salute.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Okay, now we're going to move on to item number 3 on the agenda, and that is roll call.
Morning.
Good morning.
Director Borges?
He's on his way. He will be here, but he's running late.
Thank you.
Had to
Director
pick up the
Crocker?
scarf with the cleaner. Here.
Dr. Maxig?
Here.
Dr. Mendez?
Here.
Dr. Pacheco?
Here.
Director Vanderpool?
Present.
And Director Wardley?
Present.
Okay, we do have a quorum, less Senator Borges, who will be here shortly. We'll move on now to item number 4, which is a request to approve the meeting agenda. Anyone have any comments, corrections to the agenda? Members of the public? Okay, Chair will entertain a motion at this time.
So moved.
I have a motion from Director Magsig, a second by Director Worthley. All those in favor, please signify by saying aye.
Aye.
All those opposed, the same. Motion passes unanimously. The agenda is approved. We will now move on to item 5, which is public comment. At this time, members of the public may comment on any item not appearing on today's agenda, but within the jurisdiction of the SJVIA. Public comment can and will be limited to 3 minutes. Is there anybody here wishing to speak under public comment? I do have a request from Sandra Brock. Please state your name and address for the record.
Sandra Brock, Post Office Box 8074, Squaw Valley, home of the last free people and a few meth labs, California 93675. I'll be very brief. I would hope that you would offer the high deductible PPO plan to people who are not retirees. The best time of your life to start salting away money in a health savings account is while you're working and earning more. When you retire, your income's usually halved. If few people want to take advantage of it for one reason or another, that's their business, but at least those who feel they're healthy and can control their health care costs could begin participating. Thank you.
Great. Thank you very much for your comments. I also have a request from Bobby Bloyd.
Good morning, Board. Bobby Bloyd, Fresno County Health Benefits Advisory Council Chair. I've been made aware of some recent concerning activities regarding the new prescription benefits provider. There seems to be a lot of misinformation going around, which is causing a lot of concern among individuals, not only in Fresno County, but in Tulare County also. We need to get some clarifications on a couple of items, as was relayed to us in the previous board meetings. We would be moving forward with no changes and no impacts on individuals. We could choose in the future to implement some additional cost savings measures going forward, but to start, we would not be implementing those, and the misinformation that seems to be passing out is there will be large disruptions immediately to a majority of the members. So I would hope today we were able to get some clarification on that, so that way that a lot of the fears that have been injected into our members can be taken care of and we can address those concerns. Some of them are quite concerning that have been relayed out, and it's my understanding that those will not be implemented right away. So we need to clarify that so a lot of people can move forward and feel good about us moving to the new prescription provider. Thank you.
I'd like the record to please reflect that we've been joined by an esteemed senator. Borges, thank you for joining us. I'm sorry the line in Starbucks was 20 minutes long and you ended up being late because of that, but welcome. We will now continue on with public comment. I have a request from Jonathan Ramos.
Hi guys, my name is Jonathan Ramos. I'm represented by the SEIU union. I work for the Tulare County Department of Child Support Services. And I just wanted to make a comment on the litigation that's actually reached national level with Gallagher Services regarding our health insurance with SJVIA. And it's reached national level. It's more than $2 million that we've been left in the hole with their services. And we just wanted to make a comment that we're in support of the litigation going against their services for getting us in this hole that we feel is actually whatever the money we have to make up, it's coming off the workers' back, our Tulare County workers. And again, just also on the prescription drugs that Gallagher was supposed to hold accountable, that there's a controversy there going on. And just again, I would like to say that we're in support of the litigation going against their services. Thank you.
Thank you. I also have a request from Laura Hernandez.
Good morning, board. My name is Laura Hernandez. I am here as a county employee, Unit 3, SEIU 521 Vice President. I am also here as an employee for the county. I'd like to start by being very grateful to Rhonda, the team, Mr. Tom Scheer, and the board for having taking the time and the opportunity to really evaluate the health plan. I really did go through the analysis and the different suggestions that Keenan and Associates did provide, and I did look at all that. I did try to embrace as much of the numbers as I could. And I just came to a few conclusions, and I had a few requests. As you move forward in your decision-making process, I looked at the pharmacy changes that are going to be impacting about an estimated 975 employees, which is about 25% roughly of the total employees that are covered by the health insurance plan. And I started to think, these are real human beings. And you all know that these are 975 individuals. So my concern is that everything that I saw was about savings, which totally I get it because I have to save money at home as well in my budget. So I understand that. But what I'd like to understand is all those savings are going to create disruption. I think that's how I understood it in people's lives. And I'm here today because I'm concerned. Honestly, I'm concerned. I have people at my work who rely on certain medications, and I know that's going to cause them a lot of stress. There's going to be a lot of changes for people who really need certain medications. It's going to cause stress, and that's what I'm concerned with. And so today I'm just here to please remind you, plead, I guess, to remember that human element, that value in those people, for that any decision you make today, that you recognize that that is not just a number. It is a real human being with a real physical address, with real needs to go to the grocery store, to make decisions. And at the end of the day, that's really what I would like from you. And I have seen, in reviewing all those documents, the attempts you have made, so I am grateful for that. But I'm here just to help bring some human centricity into what decisions you make today. Thank you so much.
Thank you. I also have a request that I haven't even received yet, but I know it's coming from Osi Osagura. Osi? Oh, you don't want to speak on this one? Okay, all right. I knew it was coming, so he's going to wait for the Kaiser item. Is there any additional public comment this morning? All right, seeing none, I'm going to close the public comment period and bring it back to the board to our regular agenda. Council has indicated a desire to have the board adjourn to closed session and take up closed session before we entertain our regularly scheduled agenda. Does anyone have any issue with that? Okay, seeing none, we will adjourn to closed session and return briefly.